Order, I apologize
That you see,
for the opportunity of the line
Our system goes
delay
down
of our
every-
lunch.
every week that they should get a message that
Call the meeting to order.
something's happening.
I was still, well,
Phones were out for that.
I was
Okay, call in or out.
I was saying
They use their cell phones.
while we're trying to pursue our meeting. So the meeting is in order now, and I would ask us to stand as we have to allegiance to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Please be seated. I would open the meeting for public comment. Anyone want to comment about the timely arrival of the lunch? But don't blame Jessica. She tried. She had it ordered for delivery at 11:45. All right. Public comment session. Anyone here wishing to make public comment? Public comment, I see no one wishing to make public comment, so we will close the public comment portion of our meeting. And we will move right along to our consent agenda, which includes the minutes from March 23, also the acceptance of the current division reports. And I think there's just one contract at this time, the tobacco prevention contract. Any questions or comments about anything in the consent agenda?
So moved.
All right, Dr. McLanders has moved the approval of the consent agenda. Is there a second?
Mr. Chairman, I would second the motion.
All right, we have a second. Any other comments or questions on this motion? If not, all in favor indicate by saying aye.
Aye.
And opposed, no. And the motion carries. We have approved the consent agenda. All right. You're going to be hearing quite a bit from Glenn today. And so while he is getting ready, if you want to go grab a sandwich, just do it, okay? And don't be bashful, Larry. All right, so yeah, really, just go ahead and do this. But in the meantime, I will turn the floor over to Glenn Bailey and give us his report from the Executive Council.
Thank you, Mr. Chairman. The Executive Council has not had a meeting since our last regular board meeting, so nothing to report there. The agenda, item A, review of current resolutions. If you go to tab 3, you'll find all the current resolutions. Probably should review those. As far as the active resolutions, it's red, number 25. And
page 31, big red letter, resolution supporting immunizations. I would suggest we review that. Has everyone had an opportunity to review that?
Now, which page is that's on 31? All right, got it.
We're in 31.
Right there, I had some blank
Okay.
pages there.
So does anyone have any issues, any questions, comments regarding that resolution?
Would you like Glenn to read this for us? What is your pleasure?
I don't see a necessary
Saying it's not necessary.
All right, all right,
Okay,
all right.
so are there any issues, questions, comments with that resolution? Hearing none.
Read the, at least, read the wherefore.
Okay, therefore, be it resolved that the Idaho Association of District Boards of Health shall support childhood immunizations and will promote immunizations through public information. Okay,
Questions or comments?
everyone still supports this resolution? Okay. And we can go on to the next resolution is 22-02, resolution to remove the food establishment license fee in Idaho code. And you can read down through the whereases, and therefore be it resolved that the Idaho Association of District Boards of Health supports removing food establishment license fees in Idaho code and allowing local boards of health to establish a fee based on the actual cost to deliver the food safety inspection program. This has been a item of discussion for us in the past. We're fortunate in District 1 that the health district has been able to review these licensing fees, but it's taking more and more time for their personnel because obviously our population is growing in this area, more food establishments, creating more of a workload for them. But the fees are set in Idaho code. We think it would be more appropriate for those fees to be established at a local level. So Health District 1 would be establishing our fee schedule for it. And it would be appropriate to the man hours and everything else involved for our health district personnel. I think that would be more logical. So I think we should continue to support this resolution to remove the food establishment license fee in the Idaho code and lobby our representatives and our senators at the state legislature to try to get this changed and taken out of the state of Idaho code. And I think we have an excellent argument in favor of doing that. So, any other thoughts?
Okay, Eric, are you going to talk about this also in a little bit?
Not this particular item, Chairman.
Pardon?
Not this particular item, Chairman.
Okay.
So Eric has discussed this with us before, presented, the data, the facts, and I think most of us agree that this should be established at the local level and taken away from the state legislature, Idaho code. Any comment?
I just a question, Eric, from, if I could, to Eric.
Sure.
Our current fees as performant now pretty much meeting our costs?
Chairman, no, they are not.
Right.
No, I think at best, they're meeting around 2/3 of our costs.
Okay,
And some of that comes down to a philosophy where there's a discussion amongst industry and the state that that the thought is that the counties provide a third of the support, fees provide a third of the support, and then at one point the state provided a third of the support. But now the state is no longer in that.
Yep.
And when we did do the last fee increase in 2018, it did move, fees up to about 2/3. But again, I think the goal here is that the local boards would have the discretion to determine what philosophy they want to apply and what an appropriate fee.
Okay, I would call our attention, Glenn, down here, adopted by the Idaho Association of District Boards of Health, June 9, 2016, re-adopted June 9, 2017, revised June 9 of 2022. Do you or Eric, can you tell us what the revisions were that came about in 2022?
Chairman, I'm not sure what exactly they're working conceptually. I don't think it's.
I think if you look at footnote number 1, just the Center for Disease Control and Prevention, that dated March 10th of 2022. I think they were just updating the reference.
Okay.
Mr. Chairman.
And I know that studies are coming out constantly, so it's something that needs to continually be looked at and updated, I think. We want to have the most current information as we argue our position, and I think this information supports that.
Don?
Yeah, Mr. Chairman, thank you. Mr. Bailey is correct. And also, these resolutions are looked at to see if they will be renewed or archived. And so it was renewed in 2022.
Okay, thank you. So it looks like we all still support that resolution. Would like to see that happen. Next is the injury prevention, which under that auspices is the resolution to support awareness, education, and prevention of suicide. And this resolution is 19-01. I think all of us have seen the headlines of the suicides that we've been experiencing, and they are not decreasing, they continue to increase. And that's a sad state. But I know that the health district has been very involved with our schools and trying to get our youth educated on what avenues you can take. And if you see somebody that's in a dire situation, to go to them and talk to them. Our suicide prevention hotlines have been useful as well in trying to do that. But this can always be updated. I know there's constantly new studies. There's no cure. Just trying to prevent it and trying to educate the public is a big project. So, are there any thoughts or comments on this resolution?
Well, Glenn, one of my concerns is some of the legislation that is being enacted in some of our neighboring states. I wonder what's going to happen, how that is going to affect the suicide rate in the neighboring states where this sex change and all this is going on, how that's going to play out.
It impacts the suicide.
This suicide. Anyone want to come? We have several medical staff folks here today. I just, at this point, I'm still glad I live in Idaho.
I suspect, if I could, that our upcoming community health assessment plan, as we do our assessment, it's going to raise high on the list. We'll probably be facing strategic planning around that. I hope so. And yeah,
But I think it's much more than simply, this sort of transgender thing. I think the impact of COVID has yet to even be seen with what we did to children during that time. I think that is going to be a big piece of that increase and of that concern. But I agree with Dr. McLandris that I think we're going to have to make some pretty significant strategic plans moving forward for that.
So the current issues obviously are going to have an impact. It will be interesting to see how other states have been trying to address these problems and whether their proposed solutions are helping or hurting the things that are going on. Because I've heard various reports about individuals that have had that have gone through the trans, had their hormones changed or body parts removed, etc. And yet those individuals afterwards are still committing suicide because they found that didn't fix what I was hoping it to do. So there's going to be a lot of fallout. So we'll see. Okay. So that was the resolution.
Go ahead, Don.
Yeah, just to kind of talk a little bit about statistics. So the national average for suicide is 13 per 100,000. In the state of Idaho, it's 22 per 100,000. And in North Idaho, it's 26 per 100,000. So we are nearly double the national average in suicide, completions of suicide in North Idaho.
And so we've been analyzing the age groups, the male, female, et cetera, and white males from 25 to 49 were the highest.
Mr. Chairman, in that age group, suicide is the second leading cause of death. The highest level of suicide happens in white males past the age of 55.
Wow.
It far exceeds even the ages of our youth. It's double that in that particular demographic.
Dr. McLandris.
yeah.
So, Don, what do you attribute the high suicide rate for in our region?
Mr. Chairman, that's an excellent question, Dr. Fletcher. There is a couple of theories. One is the remote nature of where we live. People don't have as much sociality. It's interesting to follow that theory. You look in New York City, they have a very, very low, close to the single digits per 100,000 in New York City. There is a theory that sociality that they have helps to prevent suicide. We also know that 52% of suicides that are completed are with a firearm. And there are more firearms in Idaho. There is more flexibility to purchase a firearm. I'm not suggesting we not have. I've got several, including an AR-15 that I own. But so the two things is the rural nature of Idaho and also the access to firearms are the theories behind our elevated suicide rate. In our suicide, our SPAN, our Suicide Prevention Action Network, we attend all of the gun shows and we provide gun locks. We do a lot of education with that group. We educate particularly regarding if you have someone in your home that has mental illness, please make sure that your please don't get rid of your firearms, but please make sure they're locked appropriately so they wouldn't have access to it.
Do you have some comments about your question? I don't mean answer, just what are your thoughts?
No, although I would ask a follow-up question. That is, if you were to take the aggregate of non-natural, quote, violent, unquote, cause of death, and by that I mean either homicide and suicide. In other words, your figure that you quoted was suicide, but the other version or flavor of violent cause of death for people is homicide. So if you were to take that aggregate number, how does that fall out geographically and regionally? Because you used the example, New York City has far fewer suicides. Well, true, but then New York City has far more homicides, and they're both sides. So my follow-up question, what would be the aggregate number? Can you say?
Mr. Chairman, I don't have an answer
Okay.
to that.
And so we can continue on. It looks like, I think everybody still supports this. Looking through the footnotes, it looks like we had information from 2019. Gosh, that's almost 4 years ago now. I wonder if we can update some of these things, or if there's other studies that could update this information for us. Anyway, just a thought. The next page is resolution 22-05, a resolution to support innovative funding streams to support awareness, education, and prevention of suicide. And this was adopted back in June of 2022. Therefore, be it resolved that the Idaho Association of District Boards of Health supports sustainable funding streams such as telecommunications fees, general state fund appropriations, or other funding sources to maintain and strengthen the crisis continuum of care implementation of the 988 suicide or the 988 suicide hotline and other suicide prevention resources and services in all 44 counties. So I think we can all still support this resolution. And
So on this various funding streams, is this the, maybe is this to be the order of their effectiveness? I don't know. What is there anything that we could come up with that's even more effective than what's listed here?
Mr. Chairman.
Yes.
So we currently do have a grant with the state of Idaho to work on suicide prevention, and it's somewhere in the neighborhood of $25,000, $30,000 a year that we get from the state. We are currently in the process of applying for a grant that would be much more substantial than that. It's a zero suicide grant, and it's to work with healthcare facilities to make sure that as they see patients, they're asking the right questions surrounding prevention of suicide for their patients. It would be voluntary. No one would be obligated to participate, but we'll be applying for that grant, and we're hopeful that gets received, and we'll be doing a lot of education with healthcare groups throughout the 5 counties to ensure that there is some screening of mental health and specifically suicide when there is a patient-physician interaction.
How do you know you're dealing with the right person?
Yes, sir.
Any other questions, comments?
Mr. Chairman, I just had a thought. I was wondering, have we taken a look at social media and putting public information, a brief blurb on social media that our youth are accessing? No, it doesn't help the older folks. I don't know what they're access is to social media and what their habits are. But it seems like that would be one way to reach the youth anyway. So,
Is there any information that reveals how long a person might be planning his or her own self-demise? Or is it on the spur of the moment?
Some of that,
well,
I think, is age group.
I know that they've connected significant emotional events in one's life with that. I don't know other studies.
Dr. Jameson?
I mean, I don't know if I know much about the studies, but I would imagine that some of that is age group dependent. I mean, I think that, you know, a lot of times when we're talking about teenagers, that there is some lack of inhibition that comes with being a teenager that sometimes plays into this, where maybe it's not, you know, they don't realize the finality of what they're going to do. So there's a difference between attempts and completion rate, and we know that for a fact. But back to your social media point, I think that the biggest growing population using social media is 65 and above now. So, I mean, the number of patients who come into our clinics and talk about what they saw on Facebook or Instagram, and you know, it's significant. It's very significant. I mean, we know teenagers are on that. I would love to see a resolution saying that we think that's a bad idea too, because I think that back to our teen suicide rate, that is a huge factor in young adults and teenagers who complete and attempt suicide as well.
Okay.
Well, almost every family,
Is impacted by suicides.
yes. Some closer, some farther away. As much as we hate to even talk about it, there was a suicide in my wife's family, her own brother who took his life as a retired adult. And there was a whole list of things that took place that gave evidence that he in detail was planning this, but no one realized it.
Education. We need to let people know, watch for these signs. Anyway, any other thoughts on those two resolutions? Okay, move on to page 43. We got a resolution regarding tobacco. Resolution 1503, page 45, resolution to support an excise tax on electronic nicotine delivery systems. Any thoughts on that? Looks like that's fairly well up to date as far as the references. Resolution to support a tobacco tax increase in the state of Idaho. I haven't heard of any legislation during this last session. I think they were focusing mainly on taxes and those kinds of issues versus tobacco.
So, not, I don't even have any clue anymore what a package or a carton of cigarettes cost. I assume that
It just keeps going up.
I like to tell people I've never stopped smoking. I always get their attention when I say that. What?
Other people smoke.
But the amount of money that gets spent on that, that maybe should be spent for food on the table for a family.
Well, I think we all have family members that have been smoking or trying to quit, going with vaping. And they thought that would be the answer, and vaping didn't work, so they're back to smoking. And my experience.
I can remember when we first passed a rule that employees could no longer smoke in the building.
That had an impact.
And how angry people got at us for denying them. And I think that smoking, secondhand smoke has affected my wife because where she taught, the teachers could smoke in the room where teachers had to go to make their copies from on the copy machine was in the smoking room. Yeah. We've made,
Policies have changed. We've come
we've,
quite a ways.
we've come a long ways, but we haven't come far enough. Are you getting ready to sing us a song?
The trumpet fanfare.
Just emphasizing your point.
Okay,
All right.
so we move on, resolution 2201. We still support an excise tax on electronic computing computer systems. And 2204, resolution to support vaping prevention in schools. I think that's still very appropriate as well. And then we come up with resolution 17-01, resolution supporting prevention of excessive alcohol use. Alcohol continues to be a problem. Looks like most of the references are pretty much up to date on that. Any notes, comments? Resolution 17-02 concerning the prevention of opioid drug overdose through prescriber education. I know that's been a huge national movement over the last couple of years. But in the meantime, our border is open and we still have drugs coming over like crazy. And I think we're seeing fentanyl everywhere now. Huge issue.
Mr. Chairman, the only thing I would sort of say about this is that last sentence there where we're encouraging active use of Idaho's PMP. As of, I believe it was April 1st, that is mandatory now to check the PMP every time you prescribe. So I think that has been made, maybe that's a big deal now. So yeah, it's not an option for you to consider checking anymore. With every controlled substance, it is required that you check and document every single time, which has not been happening.
And that's federal?
That is, it is not federal. I believe that's
Policy.
Idaho State
That's
that has
Idaho
instituted
policy.
that as of April 1st. There are some other federal changes that are coming for our DEA licenses that relate to ongoing education for addiction and abuse and that sort of thing that will be mandated, I think, by June now. But there have been a lot of recent changes in regards to this that I think will be overall very beneficial. More time consuming, but the right thing to do.
Take that a step farther than uh, how is that working out, and what are you finding out that you didn't know before?
I check the PDMP because I prescribe opioids. I think some of the challenge comes in with our, there are some other subspecialties who may not routinely prescribe these things. Maybe they're prescribing them post-operatively, and so that, they would never check, you're gonna need these opioids, but it would be very, 20% of everyone we give an opioid to is going to become addicted to that, no matter what the indication is. And so now we have surgeons and surgeons, APPs, nurse practitioners, and PAs who are required to check every single time and with every fill. The challenge you run into is, as you pointed out, is that Washington is 5 miles away, right? So it is another system in order to be able to check the Washington prescribing. And so whereas, most EMRs now, when the medical record, when you pull up to prescribe electronically, it will show you the Idaho PDMP. But maybe 40% of our patients are coming from Washington, and so you actually have to proactively log into another system in order to check, has this patient gotten anything from Washington? So that still remains a challenge because they don't all communicate very well, which to me would be the next logical step for you to be able to see across all these state borders.
I would add, in our electronic health record, we cannot send an opioid until we check, we're blocked. And then second, we're directly connected into Washington PDMP, so the systems are directly connected. So states are connecting the electronic health record and making everybody more aware of it. But I can't send an opioid unless I check my patient's PDMP. That shows me who and when has prescribed every single controlled substance, from Valium or benzodiazepines or all the opioids. They're listed. I can see if you sent my patient a prescription, when they picked it up, what was it, and how many pills. So it's an internal check system. If you follow it, it works. Yeah.
Those who are against it are the ones who probably should be for it.
Regarding making that required, yeah, I think I haven't met physicians who are against it, so I'm not sure where that would come from, as long as it's efficient.
Meantime, the state of Washington and the state of Oregon are legalizing all these recreational drugs.
Well, that's a different story. Yeah. Called recreation.
It's not recreational, it's deadly. Anyway,
Well, that's the next one, 1903.
now resolution 1903, resolution opposing the legalization of recreational non-medical marijuana. And whereas marijuana concentrates potencies of 90% THC and above are becoming more and more common in states that legalize marijuana sold on their own as part of kid-friendly edible products like candy, lollipops, gummy bears, and distinguishable from non-pot-based products. Yeah, et cetera, et cetera. And the,
Mr. Chairman,
Yes.
if I may. So I think this policy is extremely out of date. So a lot of the references are 2009, 2016. We have a lot of data since then that shows different things. In fact, we have pretty robust retrospective data that says that when we change cannabis laws in states, that actually the teenagers are not the ones who are increasing their use, it's the adults. And so some of these statements are a little concerning. I would also simply point out that that there is a move now to not call it marijuana, as there is a racial undertone to that. And so we're now moving to call it cannabis as much as possible. And certainly pot, the word pot that is in here is probably a little antiquated as well. We all know what it means, but I think if we're trying to form a professional statement, that we should probably be consistent in the nomenclature, because, and this is recreational, but when you're talking about we are one of 3 states that does not have any, 3 states out of 50 that has no medicinal cannabis
Use
law.
of cannabis.
Yeah, and so obviously that's a whole different resolution that's in there that is not up for discussion here, but I do think that some of these statements are true, but I think that we have a lot more data, and not that the data is conclusive, but the data says we just don't really know. We can't make these strong statements about, you know, if you're going to be using marijuana, then you're likely to become addicted, to develop an alcohol problem anymore, because that's a pretty antiquated statement. Not that it's not possible, but it's that we have much more data since 2009 or 2016 that says that a lot of this we just don't know the answer to. Things where we're talking about positive workplace marijuana tests above the national average in these states that have legalized, but workplace marijuana tests tell us absolutely nothing, because you can have a positive workplace marijuana test and have used cannabis legally in your state 4 weeks ago, 5 weeks ago. It does not tell us that you're acutely intoxicated, which is what we're looking at. Things like the Federal Transportation Department, we're down 100,000 truckers, and those are the same number of positive urine THC tests that we had in 2022. So, you know, I think there's some room for this to be updated. Yeah, I do, and I don't know that it'll change the resolution necessarily, but I think that if we just blatantly say, yeah, let's renew this one, we look like we're operating 20 years in the past.
I would agree. I would add that that data is totally available at the University of Washington Population Health Initiative, which is a multi-billion-dollar investment from the Gates Foundation in the University of Washington. So Population Health Initiative. So that data is available. Like, we don't have to search for it. They have it. We just have to ask for it. So yeah, we just have to ask the right questions. And so I agree with putting out there, this would be a temporary resolution that should be updated by next year, because it sounds like we're already down the path for this year, right?
Somebody needs to be assigned to update this, if you could, please.
Mr. Chair.
Yeah, well, yes.
Yes, I appreciate your comments, Dr. Jameson. So there is a process to update these resolutions. The time when the review of these resolutions takes place will be at our June meeting, our IAB meeting here in June. I don't know if that's time to update this, but that's an excellent opportunity to do that. I think most boards would like to review those changes prior to that meeting in June. I think most boards are meeting again close to the end of May, so I know that's a short time frame. But any board member can take it upon themselves to make those changes, and then they are submitted to all of the boards of health around the state.
Okay, Don, would it be the logical route for the district who submitted this in any given resolution originally to stay with it and keep it updated?
Honestly, I don't think it would have to be, Mr. Chairman. I think that if a board member of another district felt the need to make that change, they could make those changes and then it's submitted. There is not an assignment made, particularly of those who originally produced it, to keep it updated.
But it seems like they should want to,
Yes, sir.
if they're really serious about their resolution.
Agreed.
Okay,
Mr. Chairman,
yes.
I have one class left in my master's in medical cannabis. I would be happy to update this by mid-May and get it out.
All right. Somehow, I think we can accept your offer. Next time. Very.
Mr.
Okay.
Chairman, if I
Yes,
may, also, Dr. Jameson, on page 7, it's also page 19 on here, there is the process here associated with the maintenance of resolutions. It looks like it normally happens every 3 years, but that could certainly happen now.
Yeah, the references are updated. So, That'd be great if you could. Okay, the next is resolution 19-05, resolution to support the recognition of senior cognitive health as a public health issue. And I can't remember what that's about. No.
It's about seniors.
Okay. So, the statement, it was readopted last year, and therefore be it resolved, public health recognizes senior cognitive health as a public health issue and encourages prevention efforts through health education programs and public policy. I know that this is a, cognitive health, Alzheimer's is a huge issue, and it's,
I would point out, just for info, that Medicare requires, or Medicare requests that every patient who is covered by Medicare have an annual wellness visit.
Yeah.
And part of the requirement is a cognitive test
tracking.
and documented in their chart so that the doctor or clinician is addressing that. So that's how we've elevated it. And we have simple tools electronically. Clock drawing, for example, uses 7 or 8 parts of your brain to draw a clock and on a blank piece of paper, and it's 10 after 11, if you remember. So there are methods that's been elevated.
Would that be a usual activity along with just an annual review
Yes.
at your doctor?
Yes, and if it's your annual review and you're going in once a year to review your immunizations and have you had cancer screening and that type of thing. Yes, it's a normal part of it for everybody.
No one has asked me to draw a clock. I'll just draw a digital clock.
No.
Perfect.
Let's go Friday.
Okay, so the references here probably be updated as well, but I know this is a huge issue that is being addressed at the national level as well. Continues to be a concern, so. All right, resolution 22-03, resolution to support raising the minimum age of legal access and use of mitragna, speciosus, kraton products to age 21. Does anyone know what the current situation is on this?
Yeah, this was reviewed last year,
Yeah.
so I don't see anything that's
That
new.
was the first time that I really heard that it was a problem and an issue, and I'm, okay.
Yeah.
But, okay, so the information on this comes from 2020, as such. Okay. So we still support that. And that is the end of the current compendium of resolutions.
At the IAB, I've been to IABs that have spent a lot of time on resolutions and others where not much time. It looks like there's plenty of fodder here for a lengthy discussion at the IAB. Okay.
And move on to the review of Idaho Association of Counties contract with Idaho Health Districts, the tab 4. We can quickly review that. It's only 3 pages. Says, the agreement between the Idaho Association of Counties and the Idaho Public Health Districts. This agreement updated the 17th day of June 2021 by and between the Idaho Association of Counties, hereafter IAC, and the Idaho Public Health Districts, hereafter Health Districts, whereas IAC is a non-profit corporation organized under the laws of the state of Idaho, owned and operated by Idaho's 44 counties, and whose counties participate in the funding of Idaho's 7 public health districts, and whereas the public health districts are created by the laws of the state of Idaho, whereas the public health districts function under the direction of the Idaho Association of District Boards of Health, now therefore, and in consideration of the mutual promises and agreements contained herein, the parties hereto agree as follows. The duties of Idaho Public Health Districts. 1, the Executive Council of the Idaho Association of District Boards of Health shall designate a liaison for IAC to coordinate and work with prior to and during the annual Idaho legislative session. And I know that didn't occur this last year, as I recall. So
I am assuming this is referring to IAC leadership being pretty much our lobbyist at the legislature.
yeah,
And you're saying that didn't happen?
no, we've included them in our meetings. They participate, but we have not designated, as it says here, a liaison. In the past, health districts 3, 4, because they're in close proximity to the legislative sessions, have assumed this role. But I do not recall the executive council specifying you will meet with them, and these are the issues that we would like to see addressed during this next legislative session. And I think that should be done. We can do a much better job of that.
Well, I thought that was why, one of the main reasons we were paying IAC was for the lobby work that their director did for us.
True. And when there's issues that we see could impact us, then we really have them hit on those.
Yes.
But I think we talked about, the issue of health district fees, food inspection fees, would be something that they could be pushing for us. And I don't think that we brought that up to Seth. So,
Well, that's interesting. When Dan, what was Dan's last name? Who was the executive director of IAC? Was
before Seth,
yes.
I forget his last name too.
Anyhow, he'd spent a lot of time as a lobbyist and also informing us of the issues that affected health districts.
So we can do a better job at this. That should be a topic of discussion, I would think, in October.
Could I,
Mr. Chairman.
Yes.
Yes, in our IAB meeting in June, this item is on the agenda. And of course, we have Seth Riggs and his policy advisor that will both be in attendance at the meeting in January. And I have reached out to Russ Duke, the district director in District 4, to moderate a discussion with the Board of Health members on this contract specifically. And if, for lack of a better term, kind of hold their feet to the fire a little bit to make sure that they're honoring what's happening in this agreement. And based on that, we may or may not sign this agreement for their support. That'll be up to the boards to make that decision, but we are up for a renewal of this agreement.
Well, if they aren't doing that,
Pay
I don't
attention.
know why we should pay them.
If I could pay attention to item 7 under duties of the health districts in this agreement. So item 7 is our duty. The health district shall provide all funds as may be necessary for IAC to manage and pay for designated lobbyists at the request of the health districts. So it's a very open-ended statement. It looks like it's outside the $12,000 for services. It's kind of indirectly outside of it.
Because it's saying,
All funds.
if that's for IEC to manage and pay for a designated lobbyist.
Well, if,
So,
if,
Work to
if,
do.
if we have to come up with more money for them to do the job, we'd have to consider that. I don't want to.
yeah, you would assume that IEC, because we do pay them, what, $10,000 a year?
Mr. Chairman, that's 12,000.
I was
$12,000.
thinking $1,000 a month in my memory.
So what are we getting for that?
Mr. Chairman, really all we're getting from that right now is we do get a legislative update from IAC, an email of what's happening legislatively, but that's seasonal, right?
Yeah.
So that's what we're getting at this point. They do attend our annual meeting. But beyond that, we did work with them on the food fees, encourage them to make it one of their purposes for the past legislative session. And although they were supported, they chose not to make that one of their priorities.
Yeah, that was their committee, isn't it?
Correct, their legislative committee.
They only had 5 issues, it seemed like,
Correct.
and the health district's
So
fees was not one of those.
another factor is that the county commissioners, due to new statute, now hold the purse strings for the health district. So the whole agreement needs inspection. And so the idea is that there's going to be all members are going to review this and try to develop a response.
Yes, Mr. Chairman, that is correct. That's the purpose of the meeting in June.
Yeah. And there'll be a leader to tame the wolves and manage the cats.
That's correct.
Okay.
Okay, so duties of the Idaho Public Health Districts, item 2, the liaison for the health district shall notify IEC of issues that require tracking, monitoring, lobbying, and/or testifying on behalf of the health districts. Hasn't been happening, so I wonder if we can discuss whether this should be another hat that the current district that's in charge of setting up our annual meeting and chairing these committees and stuff, should that individual also be the liaison as specified here?
Mr. Chairman, I think that would be an excellent item to bring up at our meeting in June. Of
Yeah.
who is that liaison? If there's nothing
So
that
we
identifies,
specify, yeah,
what's
because
specific.
it hasn't been happening.
that is correct.
Item 3, the health district shall provide Board of Health members and local public health staff necessary to testify or otherwise contact legislators on public health issues. That's common sense. And I think that's appropriate. Item 4, the health districts through the finance office at District 2 shall pay the sum of $12,000. Yeah, that's what we do on the annual contract. Payment shall be made as follows, blah, blah. I think that's still appropriate, but I think we'll be probably discussing the contract and what we're getting for our dollar this upcoming meeting. Item 5, the health district shall meet with the IAC for strategic planning of yearly legislative issues prior to the IAC legislative planning meeting.
Well,
I think there's a timeline. This occurs on the same timetable each year. So we get wrapped up in November with our legislators from our area versus also taking a look at what needs to happen for strategic planning. I think we need to have our trustees, the executive board, really hit this hard in October.
well, I was thinking that very thing. That's the trustee's job in the interim.
Mr. Chairman,
Yes.
there is also an item at the meeting in June of what are the responsibilities of the executive board versus the trustees? And how do we delegate responsibilities? I think that clarity will be helpful as well.
Well, it's the same, aren't they?
Mr. Chairman, no, they're really not. The trustees, basically, they have one responsibility, and that's to decide on distribution of funds that are given through legislative process. And that is really their job. The executive team is there for everything else, is the way it's been explained and set up. And I know District 7 is interested in clarifying what that looks like. Consequently, it was put on the agenda. I think it's a good discussion to have.
Since the funding of the health districts has changed, you know,
Very true.
the board of trustees really functioned as they did with the, the formula, et cetera, which,
Well, Mr. Chairman, there are actually two formulas right now that come legislatively. One is the Millennial Fund, and second is home visiting funds. Those are the two right now that we make decisions, or the trustees do, of how that money will be distributed throughout the health districts.
okay.
And just to show you, Mr. Lynn, that I haven't completely lost it. Dan's last name was Chadwick.
Chadwick, that's right. David Chadwick. Thank you.
I got it.
It's still there. You just have to-
Can you draw a block?
Okay, item 6, the health district shall designate 2 contact persons to serve as ex officio members of the IAC Health and Human Service and the Energy, Environment, and Land Use Committees. And I'm not aware that that's been happening either. So these are things that need to be brought up for the board and the council and done each year specifically. And we need to put out reminders to the health districts that this board should come up with issues that need to be addressed. Send that to the board of trustees, the executive council, et cetera. It's a process that hasn't been happening. Okay, and page 68, item 7, the health district shall provide all funds as may be necessary for the Idaho Association of Counties to manage and pay for designated lobbyists at the request of the health districts. If there's a big issue that we say has to happen, then yeah, that's where the lobbyists would come in, I would think. Okay. Next section is duties of the Idaho Association of Counties. IAC shall designate staff for purpose of monitoring and at the discretion of the IAC lobbying and or testifying on behalf of public health issues. That has not been emphasized. Item 2, IAC shall monitor and advise of actions that may impact the Idaho's legislative session and the actions of the Idaho legislature and report to the health district's contact person on those actions affecting public health issues. That hasn't been happening. IAC shall advise of the necessity for action, including testimony, lobbying, or making contacts by members of the health districts.
Mr. Chairman.
Monitoring.
That is happening, probably not as robust as it should, but as I mentioned a moment or two ago, we do get reports during the legislative session of issues that are affecting public health.
Yeah.
And usually the opinion of the legislative body regarding that issue, the legislative body associated with the IAC, on those issues.
Okay. So item 3, IAC shall provide in their regular legislative bulletin a highlighted or defined section which reports on the health district's issues during the Idaho legislative session. So I'm not aware that that's been happening either. Item 4, IAC shall meet at least quarterly with the health districts and its executive council committee to address identified policy issues. During the legislative session, IAC shall meet at least bi-weekly with the health districts and its executive council committee to address legislative issues affecting health districts. This has been kind of hit and miss, depending on the pending legislation and whether it involves the health districts.
Mr. Chairman, I think the only thing that's happening there, Glenn, is when you convene an executive council and we invite them to attend. And that's certainly not bi-weekly.
No. So does this need to be revised? I don't know. As needed instead of bi-weekly?
Well, if they do it, do the job well, that should be awful enough.
Okay, item 5, in the event that health districts have need to work on legislative issues that are in conflict with IAC and/or IAC policies, IAC will inform health districts of such conflict, and the health districts will remove such issues from this contract oversight and deal with the issue at the health district level. I don't recall that that's been an issue in the past. Number 6, IAC, with the advice and consent of the Idaho Association of District Boards of Health, may designate an outside lobbyist to assist with lobbying for public health legislative issues. Management and physical oversight of this person will be provided through IAC and reimbursed by the association office. If we experience that with legal counsel and a lobbyist in the past, so that item is still appropriate. Term, this agreement shall commence on June 20th, 2019, shall continue on an annual basis until either party has given notice to terminate the contract prior to October 1st of each year. So I think that's still appropriate. The amendments to this agreement, including the performance of additional services for new or special projects by the Idaho Public Health Districts and the costs associated with them, shall be agreed to in writing and made a part of this agreement. That's still applicable, so. Any other thoughts or comments? Hearing none, okay. Well, Mr. Chairman, that concludes.
Thank you.
Yeah.
but I anticipate some discussion.
Yeah.
And by the way, as I'm sure maybe you all realize that since the IAB is being held in our district, our trustee, Mr. Glenn Bailey here, is the chair of this year's IAB. Go for it.
Thank you. No pressure.
Okay. All right, thank you. Thank you for that report. Now we move on to you, Eric, I believe. You have the floor.
Thank you, Mr. Chairman. Members of the board, the first agenda item that I have for you today is a fairly straightforward request that we raise the fee for the ServSafe course that we offer from $125 to $150. This is simply a reflection of the cost of the materials and staff time it takes to put on this course. It is a voluntary course. It's not a mandatory course that they take it from us. As a bit of background, in 2016, when Health and Welfare updated the Idaho Food Code, they did require that each food establishment have a certified food protection manager. The ServSafe course is just one of many courses that satisfies this requirement. So if a food service operator wants to attend an online course, or if they want to secure this certification elsewhere, they certainly can. We frankly only offer the course as a convenience to local operators so that they can come into one of their local offices. We do take this on the road to other outlying counties as well. So,
Yes, Dr.
A
Flanders.
question and then a motion. Food trucks serving food have to do this as well? All food trucks?
that's correct.
Yeah, that's what I
Yeah,
thought.
the only exception is the temporary food vendors. There is a lesser training that they have to complete.
Sure. And then I would make a motion to increase the fee for the ServSafe food protection course to $150.
I'd second the motion.
All right, we have a motion and a second to increase this fee from $125 to $150, beginning,
Say July
Motion this meeting.
or
Tomorrow.
Yeah.
at the
okay,
discretion of the board.
all right. It sounds like they want to, so just don't say tomorrow, just say April 28th, whatever
Because-
tomorrow is.
It has
Well,
to be
you may have
published,
some-
and so
maybe
there's
some tickets already.
requirements for publishing, change
Yeah.
policy.
I guess I should say in most cases, we seem to make these effective July 1 as
Let's do that. I'll adjust my motion to July 1.
All right, okay,
I would second that change.
all right, so,
Mr. Chairman.
yes,
So having taken that course, which parenthetically was excellent, and prior to taking the course, I did research on other options. Even at $150, it's a bargain.
Yeah.
I'm just saying, I mean, are you losing money at that rate?
Mr. Chairman, no, that is our actual costs, and it is a bargain. It's not half of what you would secure that course at elsewhere, but it's close.
Pretty close, yeah. I mean, I remember seeing some that were 200, 300. Right.
And Mr. Chairman, if I may, one of the other benefits of the course, it's an 8-hour course, and the certification is good for 5 years. But one of the benefits is it does give an opportunity for local food establishment operators to have a dialogue with inspectors who put on the class and ask questions specific to their operations and get specific answers. So it's an excellent training opportunity as well as collaboration opportunity with our local food vendors.
Eric, how many people do you have qualified to teach this course?
We have around 1,500 licensed food establishments. However, there is an allowance within the Idaho Food Code that if for chain restaurants, they can have one certified food protection manager that oversees, multiple franchise establishments. So it's best guess somewhere south of 1,500.
Span of control.
Okay, are we ready to vote on this? Effective July 1.
Yeah, fiscal year.
Okay. All in favor indicate by saying aye.
Aye.
And opposed, no. Thank you. Motion carries. All right. I think you're not through with this yet.
That's correct, Mr. Chairman. The second agenda item that I'm presenting on today is the current 5-year facilities plan for health district offices. And one of the things that I should note is that this is a bit of a dynamic process. This is current as of the most recent assessment of facilities. However, as I consult with our maintenance, senior maintenance fellow, Pete, this is subject to change based on needs that arise from our outlying offices. But as of today, this is current. We do categorize these into 3 basic categories. Priority A are items that need to be addressed fairly immediately because they do impact personnel safety or potential damage to our facilities. Priority B is things that we want to look at improving or completing in the next 1 to 3 years. Priority C's around a 5-year time frame. In some cases, they can be a bit of a wish list, if you will, or maybe potentially be a little bit further out, but they are things that we've identified a value or a need for, and so we're keeping an eye toward them. So the Benowa office, the other thing that I should note is I did work with Christine, and we did identify funding for completion of a number of these, which is noted within each of these slides. As far as priority A items, there is a need to refinish the exterior wood trim in the St. Mary's building. Money has been set aside for that. There is also some security improvements that we would like to see, which involve, adding badge access and cameras to that building, similar to what we have in the Bonners Ferry, Sandpoint, and Hayden office. We do have a combination of funds set aside from that, as well as the CDC infrastructure grant that we're looking at. Pending approval of our budget, we are going to meet again with Allied and take a look at what is some practical improvements we can make to that building that is at a reasonable cost. Priority B items include some repair work, in the parking lot, painting of the parking lot, as well as we had some sidewalk damage where there was some water intrusion and some heaving. I think that can create something of a tripping hazard, but that's been an issue for a number of years, and we're looking at getting that completed. We also have a few items in regards to some heat tape and some rebarking and tree removal. The priority C item, the exterior water or the fire suppression system, we've had some leaks. It's a dry line. It's a pressurized dry line. And in this past year, we did install or have a nitrogen system installed to minimize the rusting, which is causing those pinholes in the system. So we're hoping that buys us some time, but at some point in the foreseeable future, we'll likely need to replace those lines to address that. In the Bonner office, with Sandpoint office, we have some heat tape and some rain gutter over the entryway. We did have, it's something of a unique situation where if we get the right weather conditions, we have ice dam that builds up and then it intrudes into the interior of the building. It caused some water intrusion right beyond, you can see the window there, right inside the carpet was fairly well saturated. So this is actually a fairly significant item that does need to be addressed, but we do have funding set aside to do that work. There's also an exterior light near the rear entrance where funding has been set aside to replace that bulb. I think the chairman also noted in one of his recent visits, some of the parking lot issues and access. I have not seen the work yet myself, but my understanding is that the city of Sandpoint did patch the holes as you enter that parking lot. I don't know if that addressed all of the issues, but I'll be hoping to get up there in the next week or two to get a better assessment of what additional work, if any, we need to do.
Well, Eric, on that issue, if there's only one person that I know of that you have to please there on that issue, and that's Mary Fiedler. And if Mary's happy, it's a good job.
Then, Mr. Chairman, I will have a conversation with Mary when I'm up there.
Thank you.
Okay. In regards to the Bonners Ferry office, obviously it was recently remodeled last year. Some of the priority A items are essentially unfinished items from the remodel. The reason that they were unfinished is we could not secure a bid from any landscaping company we couldn't even get a number. We couldn't even get a return phone call. So we have had some feedback from some landscaping companies up there to complete these items, which specifically we did remove that. This isn't a good shot of the building, but if you were coming in the front entryway, there was a big concrete planter that was removed because there was some water intrusion into the building from that planter. So that was removed, but there's some faux rock, kind of a facade trim that needs to be completed around that front of the building, as well as some landscaping items as far as some tree and shrub placement and whatnot. So again, that is budgeted to be completed in this upcoming fiscal year. Priority B items is we'll work with the city of Bonners Ferry and see about refinishing or resealing that shared parking lot with the Restorium. But again, an item kind of looking down the road on that. And priority C is a generator. That is a pretty significant expense. The true value of the generator is for our vaccine storage and having some backup so that when we do have power outages that we don't have a staff person that's trying to race up there and move those over to the hospital. Because usually when we have power outages, it's because we're in some sort of storm and weather conditions are poor, road conditions are poor, and we're sending somebody on the road to move those items. The Kootenai County office, I shifted this slightly because the priority A items are likely, as you can see, not going to be ideally implemented until not this upcoming fiscal year, but the following. But if you've been around this building, there are areas where the flooring is separating at the seams. There are some areas downstairs and high use areas that have significant wear and tear. The plan would be to transition through a 5-year plan where we would basically break the building into portions and then upgrade the flooring throughout as appropriate. And as you can see in priority B, we're also looking that certain areas that may need paint would also be addressed while we're in some level of construction. And then priority C is parking lot sealing and striping. And one thing I should note on this is that as being newer to the facilities management, we did have some work done on the parking lot, but this actually needs to be moved up more into an A category. And working with Christine, we did set aside some money to where the entire parking lot needs to be sealed. We had some patchwork done a couple of years ago, but this is actually basic maintenance. The recommendation is that the entire parking lot is sealed every 7 years. The last time we had this done was in 2017, 2018. So it is due up, and it is an item that is where funding has been set aside to do this upcoming fiscal year.
Preventive maintenance
Correct.
avoids a lot of other problems.
That's correct. Shoshone office, Kellogg, obviously it's a short list because it's a leased building. And similar to the St. Mary's building, again, some monies has been set aside. We also have some CDC infrastructure monies where we would look to putting in some reasonable security precautions for staff, some badge access, those type of items, but keep it keep it practical and reasonable based on the fact that this is a lease building. So that is what I have for you today. I'd certainly welcome any recommendations or suggestions on items that you have noted that you believe need to go on the list.
Going back, Eric, to that Sand Point building where that water and ice was clinging to that rock, has that survived without too much damage over the few years when we have had some freezing on those rocks?
And it has. There's no apparent damage that's occurred. Again, it requires a unique set of conditions in order for it to intrude into the building. So it wasn't occurring all winter long. It was just occurring occasionally, and being addressed once we noted the conditions that were causing the condition, they were being abated as much as possible. So, no, the short answer is no, there's
And
no.
that's good, because it looked bad when it was actually freezing on
Yes.
those rocks there.
Would heat tape be appropriate to prevent that?
We have an estimate. We did request contractors take a look at that, and that is the solution that they identified to resolve the issue. Any other questions?
If I could, I would just compliment you on your clarity of presentation. All these buildings are powered and matter a lot to us, and thanks for your work and clarity on that.
You're welcome. I honestly can't give enough credit to Pete. I mean, he is always on the go, and he is always out at those outlying offices and keeping a very close eye on our interests for certain.
And one of the mistakes on this very building is all the noise we have to put up with all these mechanical items right above us.
Right. Thank you.
But we don't expect you to do that right now.
Mr. Chairman, could I suggest we take a 15-minute recess?
Absolutely. We are in recess. And following recess, why, we'll give some time.
Feel free to grab some lunch.
Yes, this is your chance.
Well,
I just can't imagine what it takes these resolutions.
All right.
How many people have Kate, we'll hear from you.
All right, thank you.
So you all have our annual report in front of you, and that's what I'll be going over briefly with you today. So this is our 2022 annual report. So that's calendar year 2022, you should note. On the second page is our director's statement. I won't read it to you, but I will highlight a few things. One being we've served over 28,000 people in the 5 northern counties in calendar year 2022. Some of our key achievements include collaborating with local government partners to establish rules that will provide protection for our aquifer and the Silver Valley. We have significant expansion of our substance use disorder services due to the opioid settlement fund. We were able to provide a $10,000 grant to St. Mary's Veterans Outreach Center due to our Suicide Prevention Action Network fundraiser walk. We also this past year established PhD's core values. Each of our team members had a say in what those values turned out to be. On the next page, you'll see we have our mission, vision, and core values. If you have not seen those core values before, those include teamwork, service, excellence, collaborative, and equity. As I'm sure you are all aware, our team is made up of about 127 staff people, providing over 40 different public health services to families, individuals, and organizations in the 5 northern counties. Next is a financial highlight. Later in the meeting, you'll get the full report from Christine, but this is just a financial highlight of note. This is for fiscal year ending June 30th, 2023. So the rest is on the calendar year 2022, but this is 23. We always like to point out that 80% of our budget comes from state and federal contracts and grants. 19% of our budget comes from county support. If you could wrap up the annual report in a one-page document, it would be this one, our year in review. So the graph here shows the number of clients served in each county by each division. So each division is our health services, our clinical division, and then our environmental. You'll see that Kootenai County, our most populous county, makes up the bulk of clients served, but the other counties make up thousands of people served as well. So clients, volunteers, students, and the community at large are served by Panhandle throughout the year in the 5 northern counties. Our community can receive services such as healthcare, tobacco cessation, parenting skills, supplemental nutrition, cancer prevention, food establishment inspections, and septic installer education. Our first division that we'll cover is environmental health. So these are the data for each of the services that they provide. Going down the graph, you'll see that it heavily weighs more in Shoshone County, and that's due to our institutional controls program that we have over in Shoshone. So that includes ICP permits issued, environmental property disclosures, and our childhood lead screening that we host an event for all year, or each year. But people can come in for lead screening whenever they'd like. Health services as our next division. This particular page goes over nutrition services, including our women, infants, and children, our nurse-family partnership, parents as teachers, and some of our health promotion services. These are just a couple of them because it only includes tobacco and our vaping services that we provide. Continuing on with health services, we include more health promotion that we provide to the community, including our senior services, including our senior companions program. So you'll see our volunteers and our clients here, and then our fit and fall proof sites. So we have fit and fall proof classes throughout the 5 northern counties, and those are exercise classes geared towards those 65 and older. Lastly, in health services is our substance use disorder program. We provide a variety of free services to our community through this program, including Detero pouches, which are drug deactivation pouches that someone can use safely at home and throw away into the trash. We also provide med lock boxes, which is a great way to keep your medications up and away from small hands. We also train people in opioid education and naloxone training. We've installed nalox boxes, 76 of them in this calendar year, 2022. We also train people in mental health. So that includes QPR, which is Question, Persuade, Refer, which is a suicide prevention class that you can take, and CRM, which is Community Resiliency Model. So that's teaching people self-regulation and grounding techniques they can use on their own. We also hosted our April Drug Take Back Day, and that's where you'll see this handout that I also provided. This is from our substance use disorder team. They put that together. It's lovely. So you can see the numbers there that we brought in for our April Drug Take Back Day. This year we partnered with Blue Cross of Idaho and hosted a site at their location in Coeur d'Alene. That brought us some extra media attention, which was wonderful. We were also able to collect sharps at that location through our partnership with the North Idaho Alliance of Care. For our clinical services division, this goes over clients served and also patient visits, and also our epidemiology department. So that includes diseases that were investigated and number of case counts of communicable diseases in the state of Idaho that were reported. Included in our clinical services, we also do cancer screening. In 2022, we did 150 cancer screenings. One of them was a diagnosed breast cancer and 3 diagnosed cervical cancers. And most of those are done through a voucher program where it's little to no cost for the client. Lastly, I would be remiss if I did not encourage everyone to support our work. So thank you all for serving on this Board of Health. What you're doing right now is supporting our work and pushing our public health services forward. I would also encourage you to follow us on social media. We're active on Facebook, Instagram, YouTube, and LinkedIn. You're also always welcome to visit our locations and chat with our staff. They'd love to get to know you. You can volunteer with our programs. We have opportunities for medical and non-medical individuals through our Medical Reserve Corps and our Senior Companions program. We also want you to partner with us by serving on a committee, just like you're doing right now on the board, but also taking any surveys so we can listen to your feedback. Lastly, and probably most importantly, please share with your friends, family, and coworkers the important work that we do for public health. That's all I have. I'll take your questions.
Questions? Okay,
Okay.
how about sharps?
Yes.
Can a person bring a container of sharps to this facility or any of the 5 facilities and to get it properly disposed of?
So we were able to take sharps due to the North Idaho Alliance of Care partnership at the Blue Cross of Idaho location where we did the drug take back day. Normally at there are permanent drug take back locations like most of the police departments, but that doesn't always include sharps containers. So you can get rid of sharps at at the dump, but they need to be contained in a sealed and proper container. Does that answer your question?
Any other questions or comments? Yes, Dr. McLanders, did you?
You were, is it because of your EMS work you're wondering? That's why you're wondering about, what does the EMS system do with their sharps?
Leave them at the hospital.
Okay.
Okay.
It's a good presentation, Kate.
Thank you, Glenn.
Thank you. Christine, would you like to present to us at this time? You don't have a choice.
I would very much enjoy presenting to you. Thank you, Mr. Chairman. We'll start with the cash report, the cash history. We're reporting
for the month end, March 31st, and it is 9 months into our fiscal year. We ended the month with $5,304,000. That left us with 5.24 months in reserves. Once we adjust for board committed funds and program restricted funds, we have 2.89 months in reserves. I do want to point out that the month of March had 3 pay periods. So I'm hoping that when we see April, we'll be back in the three-month reserve category, 3 or more. Our budget to actual, I'll do a high-level review of this because nothing has changed since last month. We are still over budget. In total, for fees, contracts, miscellaneous, we are under budget, as previously mentioned, in environmental due to inflation costs, slowdown in construction. Also under budget in clinical, as previously mentioned. Timing difference is related to that under budget of $16,400 for a county appropriations. We remain under budget for personnel expenses by $531,000, under budget in operating expenditures by $316,600, and capital expenditures also under budget. Trustee benefits that we've talked about frequently, it seems, over the last few months, we are over budget by $92,000. Fiscal year 24 budget, we did budget for more in trustee benefits. So total expenditures, actual expenditures were $9,105,000. So the excess of cash is $1,171,000. Once we subtract our expenditures from our revenues, we adjust for our change in accounts receivable, add that to the beginning cash balance, beginning fiscal year cash balance, and it brings us back to the $5,304,000 for budget to actual March ending. Any questions on this, Mr. Chairman, before we move to the fiscal year 24 budget?
Looking good, keep going.
Thank you. Oh, that's right. Okay, I'll try. No, I'll try it with the mouse. Thank you. So here's our annual reminder of how our funding is calculated from the counties. 70% of the funding is based on population. 30% of the funding is based on market value for assessment purposes. And this is in state code 39424. So you'll see how that calculation plays in a few minutes. Now we did a high-level overview in March, and we have had some changes, so we'll address what those changes are. The total budget for fiscal year 24 is $12,979,000 compared to fiscal year 23's budget of $13,029,000. Now remember, in fiscal year 23, that included home health, which was approximately 9% of the budget, or $1,150,000. So you'll see that in the change column, we have the biggest change in our budget in salaries and in health services down here in revenue. So most of that change, due to the loss of home health, has been absorbed by 2 other programs, which I'll also discuss as we go through this. What I'd like to do, I would like to start at the bottom with the revenues, since we need to determine our revenues, and then once we know our revenues, we build our expenses. So we have reserves for fiscal year 24 of $846,600. That is an increase of $839,000. And basically, first let me define reserves, use of program activities. That represents funds that we have already received. We received those funds in fiscal year 23. Prime example, the opioid funds. We will be using those, excuse me, in fiscal year 24. So that's our revenue piece for fiscal year 24. Program advances of $846,000. And most of this represents the opioid funding. About $750,000 of that is opioid funding. And let me just get to my notes here. Approximately 60 is coming from parents as teachers funding that we had received in fiscal year 23, which will be rolled over to 24. And we had a very generous donor that provided us some money in the Senior Companion Program. So that will also be used in fiscal year 24. So that's what represents the $839,000. Most of that, again, $760,000 is related to the opioid settlement funds. Licenses and fees, environmental, it's a decrease of 12%. That aligns with what we've been seeing in activity this fiscal year. We can see that as of March 23rd, our budget to actual for environmental is down 16%. We anticipate that to change a bit over the remaining fiscal year since the weather is getting nicer. But we've aligned our budget projection based on what we're currently seeing in activity for fiscal year 23. Health services, we've budgeted $1,365,000. It's a decrease of $1,225,000 compared to prior year. Again, $1,150,000 was related to home health. We've decreased by approximately 7% our clinical revenue because our patient visits have been down and our activity related to flu and COVID has been down. So we've adjusted our clinical revenue based on what we're seeing in actuals for fiscal year 23. Contracts and grants. This is the change that occurred since we last met in March. This change, an increase of $539,000 compared to fiscal year 23, is related to, and Eric alluded to it a little earlier, the CDC infrastructure grant. And what that grant is, it's new federal funding as a result of the pandemic. And it allows us, or it's intended to help meet critical infrastructure needs in both the short and long term. And the grant allows for maximum flexibility for recipients to carry out the grant work. And the scope of the workforce, it allows for a workforce component, and it includes investments in hiring, retaining, supporting, and training employees, staff. We had the opportunity to create a wish list that we submitted to DHW early on when this was still being developed, And in our wish list, what we've included is, and again, high-level wish list, because we really didn't know how much we would be awarded. It just came in this morning. But what we included in our wish list was the possibility for a grants compliance officer, possibly a FAB accreditation specialist, a suicide prevention support individual, HIPAA privacy and security certification and implementation assistance, website management and maintenance, and file maintenance and upgrade to our file management system, and some infrastructure improvements. So that is what we've included, some ideas of what we've included in that grant. And when we get to the expenditures, I'll mention what those expenses are and where they're housed. So that grant is $443,000 of that $539,000, and the remaining is additional funding that we've received for vaping for the Millennium Fund. So that represents that increase of $539,000. Donations, other miscellaneous income, we budgeted based on what we're currently seeing, which is a decrease of $13,000 over prior year. As I mentioned last month, interest, I believe I have probably underestimated this, and I would prefer to do that. Early on, interest rate in the fiscal year was very, very low. It was like 0.008%, I think, or 0.08%. And I just looked this morning at March, and we're at 4%. So I think I've kind of done an average, but lowballed it for fiscal year 24. County funding remains the same. We're not asking for an increase. So county funding is $2,496,000. Before I move to expenditures, are there any questions, Mr. Chairman, on the revenue component?
Mr. Chairman?
Yes.
Christine, my question is, the reserves and program advances,
Mhm.
say opioid dollars?
Mhm.
Okay, so we received those funds. What would be the duration of that? What can we anticipate? Is that just one time, or is that going to be on an annual
The opioid funds,
settlement? Yeah.
we will be receiving those funds for a period of, is it 28 years?
Roughly close to 16 years.
16
Yeah,
years.
that's,
At approximately $400,000 a year is what we roughly estimated.
okay. And also, the contracts and grants, the CDC funds that you spoke of, a grant of $443,000.
Mhm.
What is the duration of that grant? Is that on a annual renewed basis, or what is the nature of that?
I did not look at the grant this morning when it came in, so Glenn, Mr. Chairman, I will defer to Dawn.
Mr. Chairman, if I may. So that is on our agenda, which I'll be discussing further here under the director's report. The grant that we received today was 1 year, although we are told that is a 5-year grant, so it would be renewed each year.
Okay, because you were talking of increasing your full-time employees based on that funding.
Correct.
Okay.
So the funding for the award that just came in, the 447, is for 1 year.
1 year.
Mhm.
Thank you.
Moving on to expenditures. Now keep in mind again that when we're looking at the change column, this is the net difference between what we're projecting for fiscal year 24 and what had previously been budgeted for fiscal year '23, and it's distorted more than it typically would be because of home health. So salary and wages, we are budgeting $6,399,000. It's a net change of $278,000 compared to prior year. Our budget for salary includes a 4% increase. Also in salary and wages is an increase of approximately 3.6 FTEs. 2 of those FTEs relate to the infrastructure grant. 1 FTE relates to the projection to bring on another psychosocial rehab specialist. And the 0.66, we know of several individuals that will be retiring or leaving the district, so there's some overlap that we have budgeted for training purposes. So in fiscal year '23, we had a total of 119.4 FTEs. Once we adjust for home health, those individuals leaving, some stayed, but those who actually did depart employment here, that was 10.43. So the adjusted FTEs for fiscal year '23 would be 108, 109 rounded. And our fiscal year '24 FTE projection is 112.62. So an increase of 3.66 FTEs.
Okay. I have a question, Mr. Chairman. As far as salary and wages, are you even keeping up with inflation? Because as I understand, inflation is 6 to 7%, bottom line. So, okay.
Mr. Chairman, the answer to your question is no. We are not keeping up with
No.
inflation. I would say in very general terms, most of our positions, if you combine our salary, our benefit package, which is robust, if you combine those two, we're reasonably competitive. Where we are not competitive is certainly nursing specific RN salaries and also certain management positions we may not be. We're probably a little bit on the border when we talk about our environmental specialists as well, because of how we compete with Spokane. But generally, we're okay from a competitive standpoint, but all businesses are dealing with inflation.
Okay. It's an item of concern.
I think potentially fiscal year '24, there may be some possibly room to better address that. Employee benefits, again, keep in mind this is the net change. And as mentioned in our last meeting, health insurance increased from $11,650 to $13,750 per full-time employee. So basically that increase pretty much absorbed any change due to home health. Operating expenditures, other than the infrastructure grant, nothing has significantly changed. We budgeted a 5% increase for risk management for insurance at their direction. We increased fuel by 5%. A number of our contracts are already, the amounts are under contract. So we budgeted based on what was in contract. So what is in here for the infrastructure grant is, again, we weren't exactly sure how it would roll out and how we would utilize those funds from a personnel standpoint for some of the categories that we wanted to hopefully some of the services that we would like to be able to implement here at the health district. So most of them are either employee-based or consultant-type based. So when I spoke to Dawn, I took the liberty of choosing to include individuals as 2 FTEs and then an amount to be included as, say, professional services, consulting services. So that may shift. The dollars will stay the same. But what we have is $247,000 in operating expenses for the infrastructure grant. And as I mentioned earlier, that could be the HIPAA privacy and security certification consultant assistant, web management, and maintenance. Specifically for compliance for search engines, Kate's been working hard with our marketing company, and they've really assisted us with search engine optimization, where people can look for something and go directly to our site and be able to find it. Apparently that was sorely lacking. Update and increase efficiency of PhD file management. Perfect example would be SharePoint, our internal intranet system. And then we would like to have some type of outdoor signage outside the building so that people would be able to see what we're currently offering, our programs, that sort of thing. So we've included an amount for operating expense there. And then we also have some infrastructure improvements, potentially IT related, at about $28,000. So in total, $247,000 related to the infrastructure grant is an operating expense. Any questions?
Mr. Chairman, I'm just curious. Have you considered AI? What's its impact going to be on your personnel? As far as numbers, those kinds of things, have you taken a look at that yet? Because it could be a big impact.
Mr. Chairman, I would say we have a lot of intelligence here within the health district, but to be looking specific of the effects of artificial intelligence, I have been reading a fair amount of that. I have some concerns about that moving forward. I think that will come up when we do, as far as HIPAA is concerned, we have a privacy component, which is protecting personal information. And then we have a security component, which is really making, we don't want bad players to be entering into our system. And we will be doing it's time for our assessment of our security systems from a computer perspective. And that would be the time to bring that up and discuss with them how they're moving forward. Remember that we have a contract with Kootenai Health to do our IT. I think that's a question for them as well.
Yeah, because AI doesn't sleep. I mean,
Yes, sir, for sure.
okay.
Moving on to capital expenditures. Eric shared with you what we will be doing in the 5 outlying counties. Before we address that again, we have budgeted for 2 vehicles at a total of $56,000. Included in the capital expenditures is $286,000 for the payment of this facility, That includes the additional payment that we make each month when we paid off the Sandpoint building. We just took that payment and applied it to the Hayden building. So that's $14,325 a month. If we continue with that payment schedule, we should be able to have this building paid off in very early fiscal year 25, which may allow us to address the compensation issue that you were talking about, Glenn.
Good.
So what we're going to do in Benewah County, we've budgeted $54,000 for the parking lot, the seal, and the restriping and the painting that Eric mentioned. $7,500 is going to Bonner County, or the Sandpoint office for the entranceway, the heat tape. $15,000 to Bonner's Ferry for landscaping, $15,000 here for the parking lot, and Shoshone County, the $40,000 for the security system. And any questions on capital expenditures? Trustee payments, we're budgeting $140,600, an increase of $130 compared to prior year. And this is mainly, again, related to the opioid settlement funding, because there will be partners that are applying for some of those funds to use for approved projects. Since it's not our operating expense, it's treated as a trustee payment. That brings us back to our total budget for fiscal year 24 of $12,979,000. Any questions, Mr. Chairman?
Well, it's obvious that you spend a lot of time on this, and I hope we can make it go.
Mr. Chairman.
Yes.
Add something to this. So as we talked about in our last board meeting, the next step with our budget is Christine and I will be visiting all of the counties. And I wanted to let the board know when those visits will happen. If you're interested in a very riveting presentation of this budget, you've heard it once already. On May 1st at 2 o'clock, we're in Boundary County. We are in Kootenai County on May 4th. This is to the commissioners, I should have added. May 4th at 9 o'clock, Kootenai County. May 10th at 1:30 at Shoshone County. At Bonner County, May 15th at 9:30. And in Benewah County on May 22nd at 9:30. After that, then on our May 25th board meeting, the chair of each county commissioners of each county, either the chair or a designated individual, which again has to be a county commissioner, will come to this office on May 25th at 11 o'clock, and they will vote on the budget at that time. Thank you, Mr. Chairman.
I was about ready to conclude, but I forgot we need to go through our allocations. So if there's no other questions or comments, we'll move on to the county allocations, where we look at the assessed value and populations. First, this is how our revenue for fiscal year 24 is broken out. We have 48% of it is going to contracts and grants, 25% to fees, 19% is county funding, and 8% is interest and other miscellaneous revenues. So here's our population and valuation change. And I will be mainly focusing on fiscal year 24 and the change amounts. The first section, and before I address the first section, the source for this data comes from, for population, it comes from the Census Bureau. If it is not available from the Census Bureau, as it was not available timely last year, then it has to come from the Department of Commerce. And the valuation information for the assessed value of properties comes from the State Tax Commission. So that is the source for the data. So population, Benoit County had an increase of 439, a 4% increase. It increased to 10,370. Bonner County had a 4% increase of 1,923 individuals to a total of 51,400. Boundary increased by 784, or a 6% increase. And that brought it to a total of 13,345. Kootenai County, it sure feels like a lot more than 3,789, but it brought the total to 183,578. So that's the population change. Total change, 7,335. The valuation, Benoit, we all had increases in valuation. Benoit had an increase of 49%. They increased by 426 million. Bonner County had a 53% increase, 5.1 billion. Boundary County, 68% increase, 920 million. Kootenai County had a 71% increase in valuation. That's a $19 billion increase. And Shoshone County, 41%. It increased by 528 million. So let's take these statistics and see how that changes the allocation by county. So again, the county funding request remains unchanged from prior years. It's $2,496,000. So what we have is, and this is hard to see, I apologize. What we have in fiscal year 24, we have the population calculation here, where it is taking the population, and I do apologize because I am also having trouble seeing. We've allocated 68,000 for Benoit County, 66,000 for Benoit County, 329,000 for Bonner County. Boundary County is 85,000. Kootenai County, the population portion is 1,176,000, and Shoshone is 89,802. For a total allocation of 1,747,000 based on population alone. Again, 30% is based on population. The valuation component is a total of, and I won't read each individual one, is a total of $749,071 here. So the total allocation for each county is under the grand total column here, but let's go down to the left-hand corner in your handout where we compare the allocation by county to the prior year. So fiscal year 24, we have Benoit County. Their total allocation is $81,205. That's a decrease of $559 per year. So this is the shift and drift that we experience every year. Bonner County also experienced a decrease. Their total allocation is $497,493. They decreased by $10,058. Boundary County, they increased by $3,231 for a total of $111,372. And Kootenai County, they increased by $10,799 to a total of I'm sorry.
Six, nine, six, three, four, five.
Thank you. Okay, yes. Is that? Please say again.
1,696,345.
Yes.
$1,696,345 will be their total for FY24.
Correct. I apologize. Yes. I will make this bigger for when we go out to the counties. And Shoshone County, it increased by $3,413 for a total of $110,488. So that is the change. That is $1,010,488, is it not? So that is the change between fiscal year 24 and fiscal year 23 for the allocation per county. Any questions? I was quite surprised when I expected it to be significant, but I wasn't expecting to see a 71% increase in valuation for Kootenai County. Yeah, that's significant.
It'll go back down maybe.
We can hope.
See some of the prices there.
Thank you, George Bush.
Final question on the budget. Any questions on the fiscal year 24 budget? I have one other item. I would just like to mention that we received it this morning. We received the audit report for fiscal year 21.
I get to handle that.
May I have input when you're done?
It says something about since your financial officer has done such a wonderful job, she will be receiving a brand new car. No, it doesn't say that. It does say this though. We conclude that the district's financial statements are materially accurate and reliable, and fiscal operations materially comply with related laws and regulations. As a result, we issue an unmodified opinion on the district's financial statements. There are no findings and recommendations in this report or the prior report. And that's about 99% because of Christine Krumer.
I appreciate that, Mr. Chairman. It goes to the fiscal team and it goes to every employee in this district. Everyone.
But you're the leader.
I appreciate that. We all played a role in that success. And just as a point of explanation, it's I'm pleased with it. I was very nervous about this audit because this was during COVID. This was during the height of COVID. And things were moving quickly. We had a lot of new employees. Funding was coming in. So I'm happy with this. I do have to admit, I think I'm a little bit more concerned about the fiscal year 22 audit because it seemed that we had more of an employee turnover at that point. So we'll see how fiscal year 22 rolls out. Not only is this a financial audit, but it's also a compliance audit. And by compliance audit, I mean, we're federally funded. We have our grants. And when I say it takes all of us it's not just the financial component. It's are we in compliance in making the deliverables? There's a Bible out there in Title II, Part 200, Grants Management of the CFR. And that's what we need to be following. So it's our program managers, our division administrators, it's everyone. And I'm grateful for them too. So thank you.
You done good.
Thank you. That concludes my report, Mr. Chairman.
Well, Mr. Duffy, could you top that with your report?
No, sir, Mr. Chairman, not even close. Yeah, so I'll make this quick. I know we've been here a long time. Just two quick items, reminding all of you of our Idaho Association of District Boards of Health Conference on June 8th through 10th. I want to encourage our board members to make sure that you get registered. If you by chance live outside of the Coeur d'Alene area, you are more than welcome to also reserve a room at the Hampton Inn and take advantage of being close to the conference. And I want to encourage all of you to make sure that you register, of course, to come to the conference, but also get your room reserved by May 8th and no later than. The reason for that is we reserved a block of rooms. If we have rooms that are not used after the 8th, we will have to pay for those rooms even if there is no one using them. So if you have any questions about registering at all, Jessica can help you with that, but we would hope that all of our board members would be in attendance for that 3-day conference. Also, the second item is our infrastructure grant. I don't need to spend much time on that really at all. On item 7, and because Christine touched on how we have suggested that those funds be used, at least in year 1, you will see that under item 7. A little bit of a history. This infrastructure grant comes from the ARPA funds. It was actually available back in November of 2022. But as for the state of Idaho, the legislature must approve any use of ARPA funds. They did agree to appropriate these funds to the health district with a very large majority. And so we had to wait till that happened in the legislature before we could have access to these infrastructure funds. And Mr. Chairman, that's the end of my report.
Fine. Is there any other business to come before this board at this time? If not, we are adjourned until our next regular meeting, May 25. Hope you can make it at the 11 o'clock meeting, if at all possible, following which there will be a lunch, and then our regular meeting will begin at 12:30 with lunch sharp at noon. Thank you, folks. We are adjourned.
Thanks.
Wow, that's a long meeting.